Hi guys, and welcome to our channel. Today we are going to be talking about top 200 drugs. We had asked you guys on this channel what you would like to see and hear about, learn about, and a lot of you came back with how to say the top 200 drugs, brand and generic name, what they are for, and in addition, we're going to give some more information about some of those medications. This is going to be part one of a 15-part series. So today we will be reviewing 10 different medications in a couple of different categories. So let's get started. The first category that we are going to talk about is drugs used for ADD and ADHD. Most of you know that ADD stands for Attention Deficit Disorder, and ADHD stands for Adult Attention Deficit and Hyperactivity Disorder. So the first medication in this category is going to be Ritalin or Concerta. Those are two brand names for this medication. And the generic here is Methylphenidate. Methylphenidate, big word, don't let it scare you. It is important to note that this is a Schedule II medication. Schedule II medications can have 0 refills. The second medication for ADD or ADHD is Vyvanse, and it has a generic name of Lisdexamfetamine. Lisdexamfetamine. Don't let these big names scare you. It will take quite a while to be able to say them, but with practice, you'll be able to. Again, this is a Schedule II medication, which means it can have 0 refills. Third medication that we're going to talk about for ADD or ADHD is Adderall. We talk about this one a lot in class. You definitely need to know this one for NHA national exam. Adderall has a generic name of amphetamine plus dextroamphetamine. Amphetamine plus dextroamphetamine. And again, this is a Schedule II medication, which means that it can have 0 refills. And this on your NHA national exam, that is exactly what it asks. How many refills can Adderall have? The answer is 0. Almost every single student sees that question on their national. The fourth medication that we're going to talk about for ADD or ADHD is Strattera, which has a generic name of Atomoxetine. Atomoxetine. Now, the first 3 that we talked about were Schedule II medications with 0 refills. This is not a scheduled medication. So it's important to know that about this one. So let's jump into drugs used for angina. Angina means chest pain. Some people say that's angina, others say angina. I've heard it done both ways. But angina means chest pain, and it is important for you to recognize what that term means for your national exam. The first medication used for angina is Nitrostat. Nitrostat has a generic name of nitroglycerin. Nitroglycerin. For those of you watching this video who have taken the class, put in the comment box below anything that you know about nitroglycerin. That's one we talk about quite a bit in class. And the second one is Imdur. Imdur has a generic name of Isosorbide mononitrate. Isosorbide mononitrate. And that is also used for angina, which is chest pain. We're going to jump into drugs used for nausea and vomiting. These medications are also known as antiemetics. Antiemetics are used for nausea and vomiting, and that is a term that you're going to need to know both in your career and for your national exam. So keep that one in mind. Take a note, make a flashcard. Antivert has a generic name of Meclizine. Meclizine. It is used as an antiemetic for nausea and vomiting. The second antiemetic used for nausea and vomiting is Phenergan, which has a generic name of Promethazine. Promethazine. This is kind of a common one, so you might have heard of this medication. The third antiemetic that we are talking about today is Zofran. Zofran has a generic name of Ondansetron. Zofran is also a common antiemetic, so you may have heard of this. Ondansetron. And the last medication used for nausea and vomiting, also known as an antiemetic, and the last medication that we are going to discuss today is Reglan. Reglan has a generic name of Metoclopramide. Metoclopramide. Okay, these are used as antiemetics. So those are the medications that we are discussing today. This is a 15-part series, so we will be discussing several more as we go on in this series. Make sure you hit the subscribe button and like this video if you have not already done so, and meet us back here next week so we can discuss further medications. And we'll see you then.